Last Tuesday morning, I received a call that still haunts me. A 73-year-old retired teacher had been found in his study, collapsed over his desk. No heart attack, no stroke, just his body quietly giving up. The family was bewildered. He seemed healthy, took his walks, ate well. His wife mentioned he'd been taking vitamins, doing crossword puzzles, even gardening regularly. By all appearances, he was the picture of healthy aging. But when I reviewed his medical history, I saw the pattern I've witnessed hundreds of times before. 3 years ago, he'd stopped all sexual activity. Completely. His testosterone had plummeted from normal levels to barely detectable. His prostate had become dangerously congested, creating a cascade of inflammatory responses throughout his body. His cardiovascular system had begun its silent decline as blood flow to essential areas decreased. Coroner listed natural causes, but I knew better. What killed him wasn't age. It was abandonment of a vital part of his biology that society taught him to be ashamed of. He'd essentially starved his body of the hormonal and neurochemical processes that keep older men not just alive but thriving. His wife later told me something that broke my heart. "Doctor, for the last year he kept saying he felt invisible, like he was already a ghost." That's not poetic language. That's the clinical reality of what happens when men disconnect from their sexuality entirely. They literally begin to fade away, not just emotionally but physiologically. I'm Dr. Eva Hart, and for the past 14 years I've specialized in helping men over 60 reclaim their vitality and health. I've sat across from farmers, engineers, grandfathers, and war veterans who all believed the same dangerous myth, that sexual wellness becomes irrelevant after a certain age. This belief isn't just wrong, it's literally killing men. This isn't your fault. For generations, we've been told that older men who maintain sexual activity are somehow inappropriate or desperate. But I've seen the medical evidence, and I've witnessed the devastating consequences when men completely abandon this fundamental aspect of their health. Most men have never been told that regular masturbation isn't just normal for older men, it's medically essential. We live in a culture where discussing male sexuality after 60 is taboo, where men suffer in silence rather than address what their bodies actually need. But that silence is more dangerous than any honest conversation could ever be. I've watched marriages crumble, not because of infidelity or incompatibility, but because men assumed their sexual health was no longer important and their partners felt abandoned and confused. In this video, I'm going to share 4 critical health consequences that occur when older men stop masturbating entirely. Consequences that most doctors won't discuss, but that could be quietly destroying your quality of life right now. These aren't abstract medical theories. These are real, documented changes I see in my practice every single week. This is about more than just sexual function. It's about preserving your cardiovascular health, maintaining your hormone balance, protecting your prostate, and keeping your mind sharp and engaged. It's about recognizing that your masculinity and vitality don't have expiration dates. Stay with me until the end because the 4th consequence I'll reveal is something even most urologists overlook, yet it's connected to a 40% increase in depression rates among older men. Understanding this could be the difference between thriving in your later years and merely surviving them. And if this topic resonates with you, share in the comments what exactly speaks to you. And if it doesn't, let me know how I can improve the content and what topic would be more interesting for you. But first, let me tell you about what happens to your body when you completely stop, because what I'm about to show you will change how you think about aging forever. The first consequence: your body forgets how to function. I'll never forget Marcus, a 68-year-old former construction worker who came to my office with tears in his eyes. "Doc," he said, "I feel like I'm not a man anymore." For 2 years, he'd completely avoided any form of sexual activity, believing it was the mature thing to do. What he didn't realize was that his body was interpreting this as a signal to shut down entirely. Here's what most men don't understand. Your penis isn't just an organ that sits dormant when not in use. It's a complex vascular system that requires regular blood flow to maintain its health. Think of it like any other muscle in your body. When you stop using your legs, they atrophy. When you stop challenging your heart, it weakens. The same principle applies to your sexual organs, but with consequences most men never see coming. When you stop masturbating entirely, especially after 60, you're essentially telling your cardiovascular system that this area no longer needs oxygen, nutrients, or circulation. Your body, in its efficiency, begins redirecting resources elsewhere. The blood vessels in your penis start to narrow. The nerve endings become less sensitive. Tissue itself begins to change at a cellular level. The medical term is use it or lose it, but the reality is more complex and frightening than that simple phrase suggests. Without regular stimulation, the smooth muscle tissue in your penis begins to develop microscarring. The blood vessels don't just narrow, they lose their elasticity. The nerve pathways become less responsive, and eventually they can become permanently damaged. What's particularly tragic is that this process is completely silent. You don't wake up one morning unable to function. Instead, it's a gradual decline that happens over months. First, your morning erections become less frequent. Then they disappear entirely. Next, even manual stimulation becomes less effective. By the time most men realize something is wrong, significant damage has already occurred. I've seen men who were perfectly functional at 65 become completely unable to achieve any form of erection by 70, not because of disease but because of neglect. Tragedy is that many of these men thought they were being virtuous, disciplined, or simply accepting their age gracefully. Marcus's story had a different ending than most. When we caught the problem early, we were able to restore much of his function through a combination of gentle, regular self-stimulation and improved circulation. Within 3 months, his morning erections returned. Within 6 months, he felt like himself again. But here's what makes this even more critical. The loss of erectile function isn't just about intimacy. It's a warning sign that your entire cardiovascular system is in decline. The same blood flow problems affecting your penis are likely affecting your heart, your brain, and other vital organs. The second consequence, your hormones crash silently. What happened to Robert should terrify every man over 60. 71, this retired banker had always been sharp, energetic, the kind of man who still chopped his own firewood and maintained his own car. But over 18 months, his family watched him transform into someone they barely recognized. He became forgetful, irritable, and depressed. His muscles seemed to shrink despite maintaining the same exercise routine. He gained weight around his middle even though he was eating less than ever before. His wife said he'd lost his spark, that conversations with him felt flat and lifeless. His doctor ran test after test looking for cancer, heart disease, neurological problems. Blood work, MRIs, cognitive assessments, everything came back normal. But when I finally tested his testosterone levels, I found they had dropped to those of a frail 90-year-old man. His free testosterone was barely measurable. His luteinizing hormone levels showed his pituitary gland had basically stopped sending signals to his testicles to produce hormones. The connection? Robert had completely eliminated all sexual activity from his life 3 years earlier. What he didn't know is that regular ejaculation is one of the most powerful natural testosterone boosters available to older men. When you masturbate, your brain releases a cascade of hormones, not just during the act, but for hours afterward. Your hypothalamus sends signals to your testicles to produce more testosterone. Your pituitary gland releases growth hormone. Your entire endocrine system gets the message that you're still vital, still alive, still worth investing in. But when you stop this process entirely, your body begins to shut down hormone production. It's not gradual. After about 90 days without any sexual release, testosterone levels can drop by 40% or more. Your body essentially goes into a kind of hibernation mode, conserving energy by reducing the production of hormones it no longer thinks you need. Cascade effect is devastating. Lower testosterone leads to decreased muscle mass, which reduces your metabolic rate. This makes you gain weight more easily and lose energy faster. Lower testosterone also affects your brain's ability to produce dopamine and serotonin, leading to depression and cognitive fog. Your bone density begins to decrease, making you more prone to fractures. Your red blood cell count drops, reducing oxygen delivery throughout your body. The effects go far beyond the bedroom. Low testosterone in older men is linked to increased risk of heart disease, diabetes, osteoporosis, and even Alzheimer's disease. Men with severely low testosterone are 3 times more likely to die within 5 years compared to men with normal levels. What makes this even more insidious is that the symptoms develop so slowly that most men attribute them to normal aging. They accept feeling tired, losing muscle, gaining weight, and becoming emotionally flat as inevitable parts of getting older. But in many cases, these symptoms are completely reversible with proper hormonal support. Robert's recovery took nearly a year of hormone therapy that cost him thousands of dollars, treatment that could have been prevented with something as simple as maintaining regular self-stimulation twice a week. If you're feeling less energetic, less motivated, or less like yourself than you used to, this could be why. And the solution is simpler than you might think. The third consequence, your prostate becomes a time bomb. The silence in my office was deafening as I explained to William what his biopsy results meant. This 74-year-old retired police officer had developed aggressive prostatitis, a painful, chronic inflammation of his prostate that was making his life miserable. He couldn't sit comfortably, couldn't sleep through the night, and was in constant pain. But here's what shocked him. This wasn't random bad luck. For 5 years, William had completely avoided any form of sexual release. His prostate, designed to regularly empty its fluids, had become chronically congested. The stagnant secretions had created the perfect environment for inflammation and bacterial growth. Your prostate isn't just a gland, it's an active part of your reproductive system that continues producing fluids throughout your entire life. These fluids are meant to move, to be expelled regularly through ejaculation. When they sit stagnant for months, they don't just thicken, they become a breeding ground for bacteria and inflammatory compounds. Think of it like a pond that stops flowing. Fresh water keeps a pond clean and healthy, but when water becomes stagnant, algae grows, bacteria multiplies, and the entire ecosystem becomes toxic. Your prostate works the same way. The secretions it produces are meant to flow out regularly, carrying away cellular debris, potential toxins, and inflammatory substances. I've treated dozens of men with chronic prostatitis who could trace their symptoms back to the decision to stop all sexual activity. Pain isn't just discomfort, it's a deep, throbbing ache that radiates through their pelvis, down their legs, and into their lower back. Constant urge to urinate disrupts their sleep, their work, their relationships. Some men describe it as feeling like they're sitting on a golf ball that's pressing against their most sensitive areas. But the risks go beyond discomfort. Multiple studies, including landmark research from Harvard Medical School, have shown that men who ejaculate regularly have significantly lower rates of prostate cancer. The theory is that regular flushing of the prostate prevents the buildup of potentially carcinogenic substances. One study followed 32,000 men for 18 years and found that those who ejaculated 21 times per month had a 20% lower risk of prostate cancer compared to those who ejaculated 4 to 7 times per month. For men who rarely ejaculated at all, the risk was even higher. The mechanism is straightforward. When you ejaculate, you're essentially giving your prostate a deep cleanse. You're flushing out old secretions, reducing inflammation, and preventing the buildup of substances that could potentially become problematic over time. William's story ended better than it began. Once we addressed his prostate congestion through regular ejaculation and targeted therapy, his symptoms dramatically improved. But the damage from those 5 years of neglect left permanent scarring that continues to affect his quality of life. Your prostate doesn't retire when you turn 60. It needs attention, care, and regular maintenance just like any other vital organ. The fourth consequence, your mind loses its spark. This final consequence is the one that breaks my heart the most, because it's the one that steals not just physical health, but the very essence of who a man is. I've seen it hundreds of times, vibrant, intelligent men who slowly become shadows of themselves, not because of dementia or disease, but because they've disconnected from a fundamental part of their humanity. They become isolated, withdrawn, and emotionally numb. Their families say they've given up, but what's really happened is far more specific and tragic. Sexual activity, including masturbation, isn't just about physical release. It's about the complex neurochemical processes that keep your brain healthy, your emotions balanced, and your sense of self intact. When you climax, your brain releases a powerful cocktail of chemicals: dopamine for pleasure and motivation, oxytocin for bonding and emotional connection, endorphins for mood regulation, and prolactin for satisfaction and calm. But there's more happening than just the immediate chemical rush. Regular sexual activity literally rewires your brain for positivity and resilience, strengthens neural pathways associated with pleasure, reward, and emotional regulation, maintains the delicate balance between stress hormones like cortisol and feel-good chemicals like serotonin. These aren't just feel-good chemicals, they're essential neurotransmitters that maintain cognitive function, emotional stability, and mental acuity. Without them, older men are significantly more likely to develop depression, anxiety, and even early cognitive decline. Studies have shown that men who maintain regular sexual activity have better memory, faster processing speeds, and higher overall brain function well into their 80s and beyond. One patient told me something I'll never forget. "Doctor, I don't feel like a man anymore. I feel like I'm just waiting to die." He was 69, physically healthy, financially secure, with a loving family. But he'd given up on his sexuality completely, and with it, he'd lost his sense of vitality and purpose. The research backs this up. Men who maintain sexual activity well into their later years show better cognitive function, lower rates of depression, and higher overall life satisfaction. They maintain their sense of identity as vital, capable men rather than becoming passive observers of their own decline. This neurochemical decline doesn't happen overnight. It's a gradual process where men slowly lose interest in activities they once enjoyed, stop engaging socially, and begin to see themselves as burdens rather than contributors. The saddest part is that many of these men have no idea that their emotional numbness is connected to their decision to abandon their sexuality. This isn't about being obsessed with sex. It's about maintaining the neural pathways that keep you feeling alive, engaged, and connected to yourself. Here's what I want every man over 60 to understand. Your body doesn't have an expiration date on pleasure, vitality, or health. The belief that sexual wellness becomes inappropriate or unnecessary with age is not just wrong, it's dangerous. Regular masturbation, even just once or twice a week, can help maintain erectile function, support healthy hormone levels, keep your prostate functioning properly, and preserve the neurochemical balance that keeps you feeling like yourself. This isn't about shame or guilt. It's about taking responsibility for your health in a way that most doctors won't discuss with you. It's about recognizing that every part of your body deserves care and attention, regardless of your age. If you've been avoiding this aspect of your health, it's not too late to start again. Your body remembers how to respond, your hormones can recover, and your sense of vitality can return. But it requires you to reject the harmful myths about aging and embrace a more complete approach to men's health. Start slowly. Even once a week makes a significant difference. Focus on the health benefits rather than performance. This is about circulation, hormonal balance, and mental wellness, not about proving anything to anyone. You are not too old to feel good. You are not too old to maintain your sexual health. And you are definitely not too old to prioritize your overall well-being. If this message resonated with you, if it made you think differently about your health and your choices, type yes in the comments. Let me know you're committed to taking better care of yourself. And if you have questions or concerns, share those too. This conversation is long overdue, and your voice matters. Your health, your vitality, and your quality of life are worth fighting for at any age. Don't let outdated beliefs rob you of the years you have left to truly live.